Hey Facebook, we are back here continuing our conversation from TV5 News at 9, Health Yes with Genesee Health Plan, here with Jim Milanowski and Ed Benning. Thank you both for being with us today.
Thank you.
Thank you. Well, let's just recap a little bit about what we were talking about at TV5 News at 9, the partnership between the two groups. Talk to us a little bit about what this is.
Well, we, through a grant that was received at Genesee Health Plan, we've been able to partner to provide services under our Rise to Wellness program and to meet some of the special needs that the Genesee Health Plan recognizes. And so it's been a great partnership. It's allowed us to expand our service to once again to meet some gaps that exist in the community.
Mm-hmm. It's important for us to make sure our members can get to appointments. They can have the coverage,
sure,
and we provide that. But if they don't have that medical home and can get into their appointments, and transportation is a big barrier to that. So we're just glad to be able to refer people to the Rise to Wellness so that they can get from their home to the doctor's appointment, and then once they're at the doctor's appointment, then they can get back to the pharmacy, groceries, whatever they need to do. Right, Ed?
Yes.
Yeah.
Once they leave the doctor's office, they need to get a prescription or groceries. We'll make sure that happens. And the beauty of the service is that it provides the flexibility to make for a great quality of life. And so someone that may be in shopping in the store, they have no idea what time they're going to arrive at the counter and be out the door. All of us can appreciate that. This flexibility allows that driver to wait there and to make sure that we take them home when they're ready, and it's a great experience.
Yeah, so today we're talking about the relationship between health and transportation. And just a reminder, if you have any questions, maybe you thought about them during the TV5 News at 9 segment, or you're thinking about them now and just saw it on Facebook, make sure to post them in the comments. We will be able to see them and can have one of you two gentlemen answer them for us. And hopefully we can get to some afterward if it's after the live. But try to get them now. We can answer them right away for you. All right, so what exactly is the partnership between health and transportation?
Well, I think Ed was talking about it in the news segment about no-shows. It's very difficult if you don't have a car. We take it for granted. We can just zip here, zip there. But if you don't have a car or reliable transportation, or you're dependent on others for a ride, it's so difficult to get to appointments. And so, especially if you think about like a young mother with their kids and so forth, trying to get everybody together and trying to take the bus or whatever. So I think it's very important, because if they can't get to their appointments, as I said earlier, then they're not going to become healthier. This was really evident to me. I was at a physician meeting, this was a few years ago, and they were talking about this no-show. You were talking about no-show rates and getting to having people not show up for appointments. And I'm like, why is it so difficult for someone, especially in the city, to be able to get to an appointment? It was in the middle of winter, so I was driving just on some of the side streets, and the roads were not plowed.
Yeah.
So that person couldn't even get to a bus stop if they wanted to just take a bus. Their sidewalks weren't done, and so those are real true barriers, especially if you think, okay, I'm going to bundle up for my kids and head out the door. And so that's what's so neat about this Rides to Wellness, is that they'll pick you up and go door to door on us.
Absolutely. You know, the need is so strong for door to door, and for an individual that will call and make a doctor's appointment, they may call in the morning and they'll be able to get them in. Then they try to find transportation, and quite often that becomes a no-show or cancellation. And so you have those rates, 40 to 60%, that fall into that category. And you even have doctor's offices today that are only operating 4 days a week because of it. And so we're able to provide a service that addresses that, to make sure that people don't end up in the emergency room unnecessarily. And the need for those, especially those aging in place. People are staying in their homes, but in their homes, as Jim had mentioned, quite often it becomes a barrier. And so we're trying to break that barrier down.
All right, so for the Rides to Wellness program, is it separate from the bus system? Or are there different cars? How does this work?
Oh yes, we've had for many years, all the way back into the 70s, we'd have a service that is a paratransit. It's a small minibus that provides trips for individuals to and from their home. But in 2015, we've added a new service, Rides to Wellness, And it's typically provided utilizing cars, and we do have some vans, but most of this is done with cars. And so the Rides to Wellness is outside of the bus service, it's outside of our paratransit. It's a special service meeting a special need, and we partner with agencies like Genesee Health Plan, the local hospitals, Valley Area Agency, and in all today about 15 agencies that recognize there's a need that goes beyond that bus, goes beyond those paratransit vehicles.
But you also, I've seen the buses that take people to the grocery store, right?
Oh, yes.
So talk about that.
Well, we had a situation in Genesee County where stores closed, made announcements that were closing, and all of a sudden we had these food deserts. And that term never resonated with me until we started addressing it and people started calling these food deserts. In one particular neighborhood, there was no stores, and we opted. This happened just before Easter, and would it go back to 2014? They made an announcement they were closing the store, and it was going to close within a week. Another major store closed. The Meyer store closed on Pearson Road, and all of a sudden we recognized people were they had no way to get to their groceries. So we started a bus service to actually link two stores, two major stores, so people would have access. And then in addition to that, we now have 9 buses that go countywide that provide trips to the grocery store. We have racks to hold your groceries inside. It's a very flexible service. It can be scheduled weekly. It can be scheduled every week. And it's a service that is being widely used.
Very exciting.
That's connected to health as well. If you can get healthy groceries, and if a person just has to walk to the corner store or to the party store or 7-Eleven, they're not going to get healthy groceries. And so they need something like this to get to their groceries. Or again, if you don't have a car, you can then take the bus. It'll take you door to door. You can use the racks. And I just want to make sure people know that, because there's such a connection with health when people can't access fresh fruits and groceries. So.
Absolutely. And just another reminder, if you have questions, please post them in the comment section. I believe we have another one coming up. Do we have any more questions here? Yes, I believe we thought we had one. All right, so what about a veteran? Do they qualify for these rides?
Actually, they do. We partnered with the Genesee County Veteran Service Office for a new service that provides 4 free rides for veterans and their spouses, widows or widowers. And they, in order to use the service, they must contact the office at Genesee County, register. Once they're registered, they come up on our screen, and we provide 4 free rides per month in Genesee County. We also provide connecting service to Ann Arbor, Detroit, and Saginaw for those that need to go to the veterans hospitals. Here soon, we will have service expanding into Lapeer and Shiawassee, and that's through a special grant. That will be coming into play for us, or fully operational in the month of August. And so veterans just need to register, and they can utilize service. And what we have found, which was quite amazing to me, the majority of the veterans that use the service today go grocery shopping.
Excellent. Well, that's very useful.
It's for their spouse. I think you said that too. So, again, they just have to register with the county at the Veteran Services office, right? And I understand it's not a difficult process.
No,
so
they'll
easy. Help you walk through that, and then you guys find out that hey, they qualify, and when they call, they can get a ride scheduled.
Absolutely.
Yeah.
And as Jim had mentioned, there's a linkage between the inability to get groceries and fresh fruits and vegetables and health, and we have become much more aware of it. And today we're transporting not only veterans, seniors, persons with disability in these wellness services, but many families. And so we have car seats, special car seats for the babies, and we'll transport the entire family, and that happens on a regular basis. Every vehicle has a car seat.
And talk about the drivers, because we were talking about this, a lot of us use Uber and different things, and they pick you up after you get out to the meeting place and so forth. But a lot of these people need assistance, don't they?
Absolutely.
So, yeah.
It's not a process where you would drive up and drop someone off. Let's say they're going to the hospital, And we, with this service, will not just drive up and drop them off. If they're going to the 5th floor, we're going to take them to the 5th floor.
Oh, that's nice.
And when they are ready to come home, we're going to go to the 5th floor, bring them down. And in many cases, we have assistants riding with the drivers when we have that need.
So how do you qualify for a program like this?
Well, there are a number of agencies that have partnered with us because they have these gaps, and Genesee Health Plan is one of them. There are many in the community. Valley Area Agency on Aging was utilizing their food delivery service to take individuals for medical appointments, and that was never intended to work that way. It came at a very high cost, and so when we become aware of these situations, we partner with agencies in the community to be able to make this happen. And so right now we're filling those gaps, and those gaps are very large.
At the health plan, we use them, our health navigators, our community health workers. If there's a need for somebody in transportation to get to appointments, then we connect them with the Rides to Wellness. One of the particular programs is our program that we work with where language and culture is a barrier. And so public transportation can be very daunting for a group of people that maybe are here, but they have difficulty with the language or reading. And so we've partnered with MTA on a couple items. One is to get them on these appointments, the Rides to Wellness, but also working with their staff on making sure there's signage, and there's this process called transportation ambassadors. So with MTA, they'll allow people that will help people that have language and cultural barriers. They'll train them on how to use the system, and they'll let them ride for free to figure that system out, so that they become really they train the trainer type of deal where people can learn how to use public transportation, right, Ed?
Absolutely. We have an extensive travel training program to make to teach people how to use our services, and in some cases, it may take us 2 weeks to have someone fully trained on how to use services, but it's been a great outcome.
Because we had one lady who was difficulty with the language, and she got on a bus, and she kept going. She didn't know how to get off the bus.
Yeah, that's
just as simple as that. And so, because she couldn't hear the commands or read the signage. So those are things that we've worked on, and on just how to train, because I could just imagine this poor woman just circling.
Nobody wants that.
And no, we don't want that. So, but she needs to get to work. She needs to get to her job or appointments. So I love this partnership that we have.
All right, so we have a question here from Margaret. She says, I have GHP, but I don't have transportation to get to my doctor's appointments or for lab work, so what do I do to get that transportation help?
They should just call us, and we can have one of our health navigators or our community health workers connect them to a Rides to Wellness, or see what other transportation services might be available for that person. So,
easy enough.
Yeah.
What about if you live outside of Flint? Can you still get a ride then?
Oh yes, we cover the entire county, and so the services are available countywide.
Excellent. So if you call GHP to schedule a ride, do you actually have to be a member of the Genesee Health Plan?
Well, again, it goes back to those programs that we help with people. So we have a veterans program, so if veterans need help navigating the healthcare system, they can come and see Evan at our office, and so he can connect them to transportation. Perlita is the one who works with that language and cultural barriers. So yeah, they should just call us and come in and talk with one of our staff, and then we can assist them with that. We also assist them with other things as well. Some people might need help getting wheelchairs or other things. We can help connect people with that. We can, if they're looking for diabetic supplies, those types of things, we'll try to help them as much as we can. We really are a one-stop place, and if we don't have the answer, we'll find it for them.
So are there restrictions at all of where these rides for Rides to Wellness can pick you up and drop you off?
No. The actual, there's no limitation on where, in many cases, that Rides to Wellness may include a grocery store, and so those are options people decide on their own where they may want to go. The only restrictions we have right now with the Rides to Wellness is that we have partnerships with these agencies, and we have not went what you call live with the public, where the public can just start using this service. That will happen for seniors on September 1, and directly after that, the general population. The reason is that we did not want to commit and under-deliver. And so when we started with 6 cars in 2015, today we have 100 vehicles on the street.
That's incredible.
By next fall, 150 vehicles on the street. So we're being cautious and careful that we don't commit to something that we may not be able to deliver. But our goal is, long-term, is to have this open to the entire community so that you'll be able to use Rides to Wellness, and especially when you consider that people are living much longer, the senior population will continue to need these type of services.
All right, so if you're qualified, who do you call to get one of these rides?
Right now, they would go through the agencies that we're partnering with. They can call the Rides to Wellness office. They can make them aware if it's Valley Area Agency, Genesee Health Plan. We have a contract with McLaren, with the Department of Health and Human Services, and many others. And so we can point them perhaps to the Veterans Office, point them to the right person as to how to get scheduled, for the ride.
Excellent. I think you started to say something too before the last question.
Yeah, just or call, anybody who's connected with Genesee Health Plan or is a veteran or any of the types of services that we offer, that they can just give us a call as well, and we can facilitate that. So
you guys are making it easy for everyone. Just pick up your phone and call.
Well, again, that's the way it should be, because otherwise, once we get those barriers, then we don't go to those appointments and we don't take care of ourselves, because we're like, okay, well, I'll take care of this later. I can't get to the pharmacy. I'll try to do that later, and then you go days without taking your medications.
Yeah.
Those are the barriers that we're trying to overcome. So
it's all about the quality of life in our community, and none of us want to have one option for ice cream, vanilla. You have to have a lot of flavors, and that's the world we live in today. And it's up to us to provide service that really addresses those needs. I will say we're #1 in the country, and we're the model, and so it's great to have partners like Genesee Health Plan be a part of that.
Yeah, that's very exciting. Also, just a reminder, if you have any questions once we're off live, we'll still be able to answer them. So if you thought of something maybe later, we'll try to get those, even if you post them in the comments section. We're not live anymore. We also have some information for you to contact if this wasn't enough for you. We've got GeneseeHealthPlan.org. That number is 844-232-7740. And MTA Rides to Wellness, that's 810-780-8946, MTAFlint.org. So once again, comments in their questions in the comment section. We appreciate it, and thank you both for being with us today.
Thank you.
Thank you. All right, see you later, Facebook.